Good day, I'm Marvin Astares from Bulacan. So I'm a jeweler and businessman. Nalaman ko si CSA through Instagram. So nag-travel ako from Bulacan to Angeles. Nagpa-high ko ako before. Si Dr. Contessa, ang galing niyang gumawa, tapos sina-explain niya bawat procedure, kaya bumabalik-balik ako dito kahit malayo. Ang concern ko kung bakit ako bumalik dito, gusto kong magpa-jaw filler. Medyo kulang pa. Nakukulangan pa ako, so gusto ko pa siya ma-enhance. Click the bell and the subscribe button to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a topic about sexy jawline. Before that, I'll introduce our new guest, Marvin Astares. There you go. Welcome to CSA, Marvin. I've mentioned to Marvin before he was just watching our videos. Now in our video, okay? And Marvin had been with us for how many years na ba, Marvin? Ilang years na tayo? Yeah.
3 years.
3 years.
Na.
How was it so far in 3 years' time?
Good.
Very good. Feeling younger and younger. Because I was asking his age, I thought you were in like mid-20s. Pero, how old are you?
30 na.
Ayun. Pero still looking younger,
Yeah,
okay?
lagang dook.
Yan. And also the quality of the skin had improved, plus of also the contour of the face, the profile of the face. For today, we'll be working on the lower third of our face and the so-called jawline area. Okay? So, ngayon, Marvin, you notice na sa mga models or celebrities, they kind of have this really sharp jawline, angled jawline, right? Napansin mo?
Napansin ko.
Yeah.
Mas, mas contoured, mas okay.
Exactly. Kasi like, you're taking a selfie.
Yeah.
There's a side that is your favorite, right? Ikaw ba saan?
Side.
Ako kasi dito, ganyan. Itong side na to. My left side is my favorite. So, ikaw, right?
Right.
Right
Yeah,
side, okay.
right.
Ideally, for like, of course, for every gender, there's something that we want to highlight. Actually, for women, we wanted to highlight mid-face section. For the masculine side, we want to highlight the lower third. But right now, even like women, they already wanted to have this angled jawline here. They want to bring out that letter L. So it's something to give a definition plus anti-aging. Because over time, this part of the face, yan, it sags down, it goes down, and you will lose that definition of this jawline area. And the angle is going away, meaning to say, it's no longer like an L or like a right angle na tawag, 90 degrees, right? Yung 90 degrees, hindi na 90 degrees, parang slant na siyang ganyan. Or it's kind of like a diagonal line already because the mandible will age. Our bone will shrink over time. So, itong jawbone na ito, it becomes shorter. So, you will lose that letter L. So, anti-aging tayo, Marvin. Because aging starts at 25. Yan. So, it's also a prevention of that aging process. So, when you lose that definition of this mandible here, what's gonna happen is you'll notice also this part under the chin, you'll also have this, they call it double chin, or also the loose or the sagginess of these tissues here. So you want to restore that good angle. At the same time, you want to give volume, restore volume, and also kind of lift this jowl here. So if you place a filler here, you're also pulling the jowls. You've heard about the jowls, no? Yung parang may mga low dito. And also marionette fold, labiomandibular fold. So what we're also doing is prevention of aging, at the same time, beautification and highlighting the beautiful parts of our face, particularly the lower third. So we'll show the procedure when we return. And we're back, so we're with Marvin here, and we'll be working on the jawline area. And I noticed actually there's already a blunt angle. So the so-called mandibular cervical angle, this part here, posterior part. So if you just like turn there, so this one became blunt already. So we want to treat it right away. Apart from preventing the aging, we want to restore that good definition of this area of the mandible here. So a while ago, we cleansed the skin. We also applied topical numbing cream. You can leave it 30 minutes to 45 minutes. And then for our doctors, if you want to know like what will be the area that you want to avoid in terms of doing injections, of course, we want to locate for the facial artery here at your antegonial notch here. So it's here. So this is a no-go zone. Okay. And that artery is located on a deep layer. It's on the bone. But as it goes upward here, it gradually will become superficial when it's near your alar area here. Okay, so this is the area we will avoid. Okay, so when we work on the angle of the mandible and using my dermal filler, a high molecular weight type of a dermal filler here, I'll be palpating for that angle of this mandible here. And for like wanting a definition here, you can go either anterior or posterior. You can do both. So depending on the case and what you want to achieve. So for now, I'll be working on the bone area here and then directing my needle on that part of the angle. So I'll aspirate. And usually at this part, I start with my hyaluronic filler at a 0.5 ml. So after giving the 0.5 ml, so case-to-case basis, again, you have to do your assessment. So sometimes we have a so-called asymmetry. One side can be like, you know, really not so defined, the other side can be already defined. So you need to do your balancing as well. So I'm pushing slowly my hyaluronic filler. It's a 0.5 ml. And if you need to add more, you can still add. So depending on the case that you're working on and the need, you can add more volume to this. So I started with 0.5 ml. And then I do my combination of a cannula method as well, not only needle. So for Marvin, 30 years old, right? Yeah. Okay. So I'll do like a letter L here. And I'll make an entry point. You may see or notice that my entry point is near the antegonial notch. But the layer that I'll be working on is the so-called subcutaneous layer or layer 2. So that's the safe layer for our filler injection using our cannula. So your cannula will also like reduce any risks for any complications. So this is blunt, and I'll just glide it towards the posterior part of the angle here of the mandible. So again, your layer is layer 2 or subcutaneous or superficial fatty layer. So I'll just do my so-called first linear threading technique, retrograde technique, and it will become like a fanning method here. So just fill in that space, layer 2 there. You're okay, Marvin?
Yeah, okay.
So I'm using a 1 ml for this one. So in terms of like creating that good angle of the mandible there, so you really have to assess the aging process, the condition of the tissues, and also like how much of the volume would you need to create that good angle, and also what your client would want to achieve. Okay, some will just still want the soft one, some would really want a robust or a sharp jawline. Okay, so for Marvin, we still want to have like in between, something in between, because if you have this kind of like, we're Asians, Asian face is known for being round and wide and short face, so we still want to balance it with the entire face shape, right? So make it within the so-called ratios and proportions. It's important to maintain that symmetry and go within the ratios and proportions and balance it with the entire face for a harmonious look, harmonious result. Okay. So I'm almost finishing with this 1 ml of my product here. So in terms of using the product material, choosing which hyaluronic substance, there are cases that we do the so-called like not a low molecular weight, not so high molecular weight. Some cases we do like a moderate or like the medium type. You can also do that because there's also like a side effect for some cases whereby the very hard filler, when your masseter is contracting, it could be bulging out. So we don't want that, right, Marvin? So there was like a side effect that they use a very hard filler, and while the client, the person was like talking or like chewing or contracting the muscle, the filler was bulging out. So you also want a material that will blend in and will integrate very well. So we can still work further here. So assessing the so-called Ricketts E line, so Marvin also has a very good profile. Okay, if you check on this one, so there's a good projection of the chin. We just wanted to improve the vertical dimension. So I can still use the same entry point and glide it in the inferior border of your mandible. So disinfect, please. So I have another syringe of my filler product here, and just glide, or rather initially insert it in the same entry point. So some cases, I use entry points also on the angle of the mandible. So it's a case-to-case basis depending on what you want to achieve and what will be very harmonious and also aesthetically pleasing on our patient. So again, this is working on the subcutaneous layer. So we're just placing it in the so-called mandibular border here, the inferior part. So we wanted to improve the vertical dimension of our chin. Marvin had filler in the past, right, on the chin. So the procedure was more of the projection of the chin. So right now it's more of elongating the chin. You're still good? So we'll do this right side here. We can use, like for example, I have already used 0.5 mil. So you can check again. You can use like 0.5 to 1 mil on this area here, since you're also targeting the apex of the chin. So you want to also reach that one. You can do like a bolus there. So some bolus can be 0.25 depending on the need. So you want to elongate this apex here. Or a simple technique, you can just inject with your needle directly into the chin apex there. So this is more of wanting to elongate your chin and also this mandibular line. So let's proceed to the opposite side. And we're back. Let's show the result to Marvin. Here's our mirror. Okay. So we still want an effect that is subtle, not too much. It's like a smooth type of jawline contouring, and we just wanted to create that angle of the mandible, bring out this specific area here. And we made use of 6 syringes of our hyaluronic dermal filler for Marvin. Okay. So how are you, Marvin?
Great.
Yeah. So initially we have some like marks from the injection and some kind of a bit of redness there. It's normal, okay? So we're just doing massaging right now. So you still can mold it. You can still do your maneuvering on the area after the dermal filler injection, okay? So usually hyaluronic substances, they last in our tissue, especially those high molecular weight Some cases have them for more than a year to 2 years. It's a case-to-case basis. But they've done some MRI on some people who have done fillers. They were seeing some fillers still there around 5 years. So it will depend also on our lifestyle, our body's metabolism, your environment as well. So how are you, Marvin? Was it painful?
No.
Not really, right? Yeah. So far, so good. It's what we call, like, when you see the result after, you can't stop looking at yourself in the mirror. Because when I've done some treatments on myself too, when I see the result, I cannot stop looking at the mirror because I'm loving the result. And it's still gonna improve over time because these substances will still integrate in your soft tissues and they attract water, they will still restore volume, and they have an effect of anti-aging and preventing aging and improving the texture of your skin as well. Because with Marvin, we've noticed some acne scars. So a while ago, I was doing like a semi-subcision, so releasing those fibrotic bands from your tethered acne scars. So how was it? Kamusta ka na, Marvin? Speechless si Marvin, right? So far, so good. Yeah. So far, so good. Yeah. Parang naninibago ka. Okay. Yes, that's the thing I've noticed after doing the treatment, because we defined the angle of the mandible, we noticed that the double chin was gone. So this is one way to eradicate any under chin bulge here, submental bulges or double chin, okay? If you do your angle of the mandible plus the inferior border of your mandible up to the chin area, the chin apex, you're also getting rid of the double chin with this kind of treatment, this kind of technique. So right now, we have this L shape or the right angle here, 90 degree. Okay, we're good. So after this, Marvin, you can do cold compress. Okay, if there's like discomfort you're feeling, you can take any analgesic. Then no strenuous activities, no heavy exercises, no like weightlifting, heavy lifting. Okay, but you can do your routine like office work or like you have a party tonight or any meeting. Yon, speechless na si Marvin.
Speechless, okay.
So was there pain while I was doing it? Masakit ba? Hindi naman, right? And then it's normal na parang heavy or something is there na unusual. Yan. Parang normal lang yan. Like there's some heaviness or some pressure, especially in this area. Okay, because the filler also has lidocaine with it. So the pain is also like, you know, overcome by the lidocaine. It will be overcome by the lidocaine. Yan. Right? So how are you? So far, so good. Yeah. Okay. So when you're taking a photo, like your favorite angle is the right side eh. Ako yung favorite ko yung left eh. Yeah. So left and right, you can do it. Then we'll still check on Marvin. Usually we do a week or 2 week follow-up to check on the symmetry or to make sure that it is balanced. And yeah, within the ratios and proportions. So 1, 2, 3 ratios and proportions. No? Achieve na natin yun. 1, 1, 1. Okay? So far, so good. And this will still settle in. So at first kasi parang feeling mo medyo ano pa siya, swollen or wide. So it will still kind of blend in and integrate, and it will still further contour. The important thing is you created that right angle. You also eradicated the under chin, the double chin. You created that good jawline, and you are preventing the sulcal jowls and labiomandibular fold, and you're improving the vertical dimension of your lower third of your face. It will still improve over time. You'll still see some more of the recontouring, reshaping of your face. It will still soften, become a smoother contour. So we wanted a sexy jawline, and it's just the right one for your personality, for your looks. Nag-iisang Marvin lang po ito. Thank you so much, Marvin. Any social media na we could follow you? Or are you into that? Yan. Are you into modeling then?
No.
Kasi parang you're good in modeling eh, no? So no social media account. Ayun, private life. I like that. Okay. Marvin, thank you so much.
Thank you so much, though.
Yes, of course. Thank you for trusting CSA. And we'll see more of you in your follow-ups. There you go. So if you have any questions, you may email us at csaskinclinic@yahoo.com. Our contact number 0933-860-9193 or 0917-504-4268. And we are located here at the Infinity Shop, Pulong Maragol, Angeles City, na lagi mong pinupuntahan, nagda-drive ka pa from
Bulacan.
O, di ba? How many hours?
2 hours.
O, 2 hours din pala, no? So, yon. And then, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Pina-follow kita Ayun, share social media. Private na lang daw po. Ayan, and our YouTube videos, please watch them, Contessa Salvador. So, God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.